quick question. If your SIBO is clear, why do gas, visible distension, and post-meal pressure keep coming back, especially after you've already done antibiotics or natural antimicrobials? Well, what if the problem isn't the kill step at all, but low stomach acid that's keeping your gut's defenses turned off? You finished antibiotics or natural antimicrobials and felt better, but then the gas and the distension crept back. Well, today I'll show you how low stomach acid quietly takes down your gut's first line of defense and why fixing it is a non-negotiable if you want relief from SIBO to last. But before we get into that, allow me to introduce myself. I'm Dr. Arland Hill, and for over 20 years, I've been helping first-time and recurrent SIBO sufferers restore their gut function by targeting all three phases of the condition to resolve symptoms in a timely manner. So let's get into why low acid keeps the cycle going and what to do about it. What does stomach acid, also known as hydrochloric acid, actually do? Well, it does several things, but let's go with some of the highlights here. One of which is going to be that it sterilizes. And specifically when you're ingesting food, if there are any microbes on that food, well, it's going to be sterilizing that incoming food. It's going to be killing off those microbes. It also is going to help with regulating how quickly your stomach empties after you eat a meal. Let me give you context on that. The more availability of acid and the lower the pH is in your stomach, the easier it's going to be to empty the contents of the stomach. If your pH doesn't drop low enough, meaning that your stomach doesn't become acidic enough because there's insufficient amounts of stomach acid, then you're not going to empty the stomach as quickly. But everything related to stomach acid and what it does doesn't simply take place in the stomach. Hydrochloric acid, stomach acid, also has effects downstream as well. And one of those is that it's going to trigger the release of bile, also an important defense line for SIBO or against SIBO, as well as pancreatic enzymes, another defense line against SIBO and microbes coming in. In addition, stomach acid is going to, as I alluded to a bit earlier, set the optimal pH. We want to make sure that proteins get digested and that initial breakdown happens in the stomach. And we also want to set the stage for extraction of nutrients off of our food. This is extremely critical for things like B12 and minerals like iron. You need an optimal acidic environment in the stomach to fully extract those nutrients from the food. So how does low acid drive SIBO? This is really the theme here, because now that you understand that stomach acid can be a sterilizing agent, if you will, you need to translate that to say that when you have less or a lower kill rate of the organisms that are coming in through food, or whether you're swallowing those, if you're not killing off those organisms sufficiently, they're going to become colonizers of your small intestine. They're going to start setting up shop and proliferating in that area. And if you think how fast this can get out of control just simply by not having sufficient amounts of acid, then recall that acid is not acting by itself. Part of acid is only reducing a portion of those microbes. What also helps further reduce those microbes are the bile and the enzymes from the pancreas. But you need sufficient acid to trigger those. And so when you don't trigger that, not only are you missing out on that direct killing effect from those gastric secretions, but the other problem now is that you're not digesting food. And when you don't digest food efficiently, for maybe just a lack of better wording here, that becomes a fuel source for the overgrowth. It becomes pouring literally fuel on the fire, if you will, because now these organisms have an energy source. And what can they do with the energy source? They can start to proliferate, and their proliferation translates into belching, the early fullness when you get satiated really quickly, the quick gas, that distension, that bloating effect. Maybe you see that change in your bowel habits, where you can start to either become constipated or go the other way towards diarrhea. Many will tend to lean towards constipation and slowed motility here. But these are all byproducts of not having sufficient acid and all the downstream effects that can come along as a byproduct of that. The question is, how do you get in this situation in the first place? And this can happen through a number of different ways, but let me just share a few with you here. One of which is that medications can cause this. For example, there are acid-reducing medications. Whether you're looking at proton pump inhibitors or what are called H2 agonists, these are going to affect the release of acid. When you don't have that acid there, now again, you're setting up shop for those microorganisms to be able to move through the stomach, move through the upper small intestine, and now they can proliferate again. Other things that can cause this, there's something known as atrophic gastritis. Atrophic gastritis is where the cells that line the stomach are not functional anymore. And that translates as there's not going to be sufficient amounts of the stomach acid secretion. In addition, you can see that you can have infections in this environment. H. pylori is the most well-known infection here, and H. pylori can damage cells in the stomach lining that secrete stomach acid as well. And then even when you have a high amount of stress, so we can say this a lot of different ways. We can just call it high stress. We can call it sympathetic dominance. What's fight or flight, being in a more chronic fight or flight state. Ultimately, what all of these are saying is that you're getting a lack of stimulation neurologically down to the stomach environment and not giving the sufficient signal to adequately release stomach acid. And these are all things that you can have an impact on. And even one of the things, and this can give you a clue of maybe something you might need to do on an ongoing basis, is keep in mind that aging can be a factor in this as well. As we age, our digestive secretions tend to decline, and we may need to do things that are going to allow us to overcome that. Which that brings us to, well, what do I do? And if you've followed my videos, you'll know that when it comes to this portion of the conversation about SIBO, I frame this under the phase 2 of SIBO. When killing off the organisms being phase 1 or reducing the overgrowth burden, and then phase 2 being where we deal with the digestive secretions, the immune system dysfunction locally, and making sure that there's optimal motility. And then phase 3 being restoring nutrient deficiencies that are an inherent byproduct of SIBO. Restoring acid is under phase 2. And there's a couple of ways that we can do this. We can be, and I'm just going to run through these with you. We can be attentive to our meal structure and our habits. Simply, maybe to state that a different way, is when you sit down to eat food, and assuming you're sitting down and you're not on the run trying to eat food, but putting yourself in a more relaxed, parasympathetic, more of a digest and relaxed state is where we want to be. That's when you're going to get ample signaling to the stomach environment, to the cells in the stomach, to optimize the secretion of the hydrochloric acid. And you want to make sure that you're not on the go, that you're not running and gunning all the time when it comes to sitting down and trying to eat. One of the other things that you can do here is, if you know that you're an individual who tends to exist in more of that sympathetic dominant state, fight or flight tends to be more of your norm. First thing I would tell you to do is, well, work on that. Take some actions to try to shift out of that state, out of that dominant state. And you can do simple things here to get you moving in the right direction. So if you think about being in the pre-meal state, right, because we need to shift out of that sympathetic dominance pre-meal, you can do things like do some slow nasal breathing, just doing some slow inhale, exhale, just to calm yourself down and to train yourself to move more into that parasympathetic state. You can also pray. This is one of the advantages to praying. If you really want to focus on your training of the vagus nerve, which is the big nerve that influences a lot of what we're talking about, it's the cranial nerve that is going to ultimately influence the stomach acid secretion. You can do things like gargling, humming. Those are going to do that. But you can also take an even more active role here where you're doing things like exercise. And this is one of my preferred ways to do this because there's going to be so many ancillary benefits to doing the exercise. But you can do mostly what is going to be moderate intensity training. So if you want to think moderate aerobic training can come into play here. Sometimes we see this talked about as zone 2 cardio now, but even going out and walking can be something that can pull you back into more of that parasympathetic state. Yoga is great at doing this, and maybe even doing some mobility, flexibility, and being intentional on that. Strength work. Strength work is a good adjunct here as well. I would just suggest that, maybe time that. I wouldn't necessarily recommend doing this right after you eat, but if you're going to do the activity and then follow up with the eating behind that, that can work very well in helping train this overall sympathetic, parasympathetic state that can ultimately influence the acid production and secretion, if you will. You can also, another way you can do this is with supplementation. There's different categories of supplementation. You can use things like bitter herbs where you're trying to stimulate the secretion of acid. Many times you'd want to do these, say, 10 to 15 minutes prior to a meal to give it that opportunity to start signaling for the release of acid. Or you can take a more direct approach, and this is often what I'll do just to try to get some results fairly quickly and get things moving in the right direction, is use betaine HCl. This is often, and I do recommend that this is combined with pepsin, simply because if you don't have adequate amounts of hydrochloric acid, the stomach acid, then you're not going to get good pepsin production either. You need the hydrochloric acid for the generation of pepsin from its pre-enzyme form. You can play with the dosing on this, so you may find that you start at a lower dose and you slowly scale that dose up to find what is an ideal amount for you where you tend to get the most benefit from that. There's other nutrients that can come into play here. So for example, let's go back to where maybe you've got damage to that lining in the stomach, the cells in the stomach that secrete acid, the parietal cells aren't as functional as they need to be. They need some restoration. Well, you can bring in nutrients like zinc, specifically zinc carnosine is a form of zinc that's been shown to be really beneficial here. You could also add in vitamin A. Vitamin A can help with this. And keep in mind, since I'm talking nutrients, you're probably going to need to correct some nutrient deficiencies that have manifested both from the low acid and from the SIBO. Again, things like your minerals, magnesium, iron, selenium, zinc, B12 as a B vitamin there, that's going to come into play. And be attentive if you're someone that has to be on the acid suppressing drugs like the proton pump inhibitors. I would say have some type of long-term plan, like have a thought process around this. Give consideration to how you're going to support other aspects of your digestion. If you don't have good acid secretion, remember that's also going to impact the bile and the pancreatic enzymes. So ask yourself, how am I going to deal with that? How am I going to overcome that? You got to think through that and then ask yourself, well, what nutrients am I at risk for being deficient in, and how am I going to overcome those as well? Now, I'll just throw this in there as a side note, you can use labs to give you some insight on this. So for example, even just standard blood labs can, when they're looked at with a pretty scrutinizing eye, and from a functional viewpoint, you can get ideas about how acid secretion is working. It's not going to be a direct observation on that. It's not a direct assessment, but you can indirectly generate that information. You can also use stool test here as an ally, because stool tests can directly give you input on the enzymatic activity. They can give you input on your bile secretion. They can tell you not whether H. pylori is a factor, so you could use that as a tool as well. But then also just simply, how are your symptoms? Are you asymptomatic? Are the bloating, the distension, the excess gas, are all of those things under control and getting better? And if they are, then hey, you've probably made the right choices. And if they're not, well, we need to dig a little deeper and figure out what's going on here. If acid is step one of protection, well, enzymes are following right behind them. And if you've got gas or bloating still after eating, well, you need to watch the next video, SIBO and low pancreatic output.